Governing what we eat.
Good morning. Welcome to Nutrition Talk. If you have eaten in a restaurant in Denmark, Switzerland, or right here in New York in the last few years, you may have noticed some changes. Our guest says those changes are for the better. Today, we're going to take a look at how governmental controls have affected the way we eat, or at least the way we eat out. Lydia Cooper is a nutrition and policy consultant who has advised local and national governments. Welcome to the program.
Thanks for having me.
For those listeners who may not know, could you explain some of the recent laws here and elsewhere that affect nutrition?
Sure, I'd be happy to. Probably the most important are laws affecting trans fat. These laws ban or restrict trans fat, sometimes in packaged food and/or in restaurant items.
Can you remind us what trans fat is and why it's become such a hot issue?
Sure. In simple terms, trans fat is the worst kind of fat in our diets. It's liquid fat, like a vegetable oil, that has been turned into a solid. The reason it's getting a lot of attention is because we think it causes heart disease. So taking it out of the food we eat can improve our health and reduce deaths from heart disease. That's why countries such as Denmark, Switzerland, and now some places in the United States have some kind of trans fat ban in place.
Do we know yet if these laws are having any effect?
Well, let's look at the case of New York City. The amount of trans fat used in restaurants has definitely gone down since it has been banned. City health officials say that restaurants have reduced their use from 50% to 2%. And diners are not complaining. However, it's still too early to tell how it is affecting health citywide. But in Denmark, they're estimating a large reduction in deaths related to heart disease.
All right. What about other laws affecting nutrition?
Well, another significant law is one that requires restaurants to post calorie counts on their menus. New York City was one of the first places to require calorie counts.
Let's talk about those calories. When restaurants first started listing the number of calories, I was shocked. The muffin I used to get at Starbucks was 500 calories.
You're not alone. I think many customers were shocked at how many calories were in their favorite foods. A recent study suggests that customers have actually cut down on calories after the nutrition law went into effect. You mentioned Starbucks. Customers at Starbucks who saw the calorie information, on average, consumed 106 fewer calories than those who didn't.
And for those of us choosing non-fat milk and no whipped cream, is it worth it?
Well, by cutting around 100 calories a day, you would lose a pound per month. Weight might not seem like a big problem in a city of fast walkers, but it is, so every little bit helps. In fact, city health officials think that simply placing calorie labels on menus can prevent 30,000 cases of diabetes.
Well, this certainly sounds like the end of the 2,000-calorie hamburger. However, what about those listeners who still feel it's not the government's role to decide whether they eat trans fat or not?
It's important to remember that the government is affected by the health of its people. Think about all of the health costs that the government and society have to pay for because people are overweight or have diabetes or heart disease, all problems related to diet.
If nutrition is so important, why aren't all cities doing this?
Well, actually, many U.S. cities have followed New York's lead, and the federal or national government has too. The National Healthcare legislation of 2010 requires calorie labels on menu items in big chain restaurants and for food in vending machines. Other countries such as Great Britain and Canada are considering such measures, but so far they haven't adopted them.
Okay, thanks, Lydia. Looks like it might be wise for the Big Apple to get some apples on the menu.